Insurance coverage rates are falling. Express Scripts makes a deal on a cholesterol drug, and synthetic opioids are overtaking prescription drugs in opioid-related deaths. Welcome to This Week in Managed Care. I'm Laura Jost. The rate of Americans who lacked health insurance reached an all-time low after the Affordable Care Act passed, but things are moving the other way, according to a report from the Commonwealth Fund. This week's report finds that the uninsured rate among low-income adults rose from 20.9% in March 2016 to 25.7% in March 2018, based on several factors. The failure to shore up weaknesses in the ACA, confusion about the status of the law, and a lack of advertising during open enrollment. President Trump's repeal of the individual mandate in the new tax law and Medicaid work requirements in some states are expected to increase the uninsured rate even more, according to the report. For more, visit ajmc.com. Praluent, one of two powerful cholesterol drugs called PCSK9 inhibitors, will soon be less expensive and easier to get for consumers who use Express Scripts, following a deal announced this week. Drug makers Sanofi and Regeneron announced price cuts and an exclusive formulary deal with Express Scripts, which agreed to end the complex pre-approval process that cardiologists had to follow to get the drug for their patients. Praluent, which costs more than $14,000 a year, will be priced in line with benchmarks set by the Institute for Clinical and Economic Review. In March, its analysis found that Praluent should cost 50% to 75% less for most patients who meet FDA criteria. Last year, Sanofi's Dr. Jay Edelberg told AJMC about difficulties patients and doctors were experiencing.
There's no precedent for what we're seeing in terms of the difficulty of our patients to be able to get Praluent when they're prescribed. The appropriate patients for Praluent, those with FH or atherosclerotic cardiovascular disease who need additional LDL lowering on top of maximally tolerated dose of statins, those patients are having a really hard time about getting this when they're prescribed. That's really unprecedented.
Part of the manufacturer's rebate will now go directly to consumers to offset out-of-pocket costs. For more, visit ajmc.com. Synthetic opioids are catching up to prescription opioids as the most common drug involved in overdose deaths. A new report in JAMA by officials from the National Institute on Drug Abuse said that about 1/7 of opioid deaths in 2010 involved a synthetic drug. By 2016, 45% of all recorded deaths from opioids involved a synthetic drug. However, the author said the actual number is likely higher due to limited information on death certificates. Prescription opioid use is dropping thanks to greater awareness and pharmacy monitoring programs. However, doctors worry that Medicare patients with cancer who are in pain are being adversely affected. The authors wrote, "Widespread public health messaging is needed, and clinicians, first responders, and laypersons likely to respond to an overdose should be trained on synthetic opioid risks and equipped with multiple doses of naloxone. These efforts should be part of a comprehensive strategy to reduce the illicit supply of opioids and expand access to medication-assisted treatment for opioid addiction." Novartis's CAR T-cell therapy Kymriah received a new indication this week as FDA approved the treatment for adult patients with relapsed or refractory large B-cell lymphoma. The approval includes patients with specific forms of large B-cell lymphoma who have not responded to at least 2 other treatments and have limited treatment options. Kymriah will compete with Gilead's Yescarta, which was approved in October to treat these patients. Kymriah was first approved last August to treat pediatric acute lymphoblastic leukemia. Finally, AJMC spent this week covering the World Healthcare Congress, where CMS Administrator Seema Verma said her agency is fostering competition in the markets and working to get patients access to their healthcare information. "We made it clear that the days of finding creative ways to track data in closed systems must come to an end. It is no longer acceptable to limit patient records or prevent them and their doctors from seeing their complete history." Former HHS Secretary Tom Price acknowledged the repeal of the individual mandate brought some market instability, but he said that he believes the Affordable Care Act has now stabilized. He said patients on the exchanges are sicker and use more health care than most people. Asked Price, "Are these exchanges the de facto high-risk pools that many people talked about being necessary, but without the efficiency or true planning of a high-risk pool?" For full coverage of the World Healthcare Congress, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.